Hello and good morning. Welcome and thank you for tuning in today for Mr. Self-Care Live, where we dive into deep conversations that matter. The conversation normally promotes mental wellness, awareness, and compassion. Today's live discussion is going to be called Understanding Autism Beyond its Surface, and we are glad you're here with us. Shortly, Autism Spectrum Disorder, or ASD, affects approximately 1 in every 38 children here and in the world at large, according to CDC. And yet, despite its growing prevalences, autism is still widely misunderstood, and many people are only familiar with the term, but not even actually understand the experience or what it means to live with autism. Autism is not a one-size-fits-all. It presents differently in terms of social capacities, emotional and behaviors. And that's why we are here to explore autism today. Autism is not just what it feels, what it means, but today we want to understand how it feels like, a picture if we are to paint it, and also a color if we are to give it one. And also at the end of the day, we want to know how to better understand and support the people that are on this spectrum. Throughout discussion, we are going to be joined by an informed, a well-known lady that will introduce herself shortly, that comes from the autistic community, where she advocates, supports, and has been a key and light in shedding more light and information about autism. She moves from one media house to another, clearing nuisance and all the bullshit that has been said about this term autism and what normally is overlooked by the mainstream media. Whether you're here as a parent, a teacher, a healthcare provider, or someone that's simply seeking to learn about autism, we thank you for being here. Autism is only the beginning, and awareness is all what we need to understand. Understanding is the real change that we all need, and I trust me, it all starts here. So get comfortable. Feel free to ask the question in our chat section, and let's dive in by understanding autism beyond its surface. Yes, good morning, Dr. Prosy.
Good morning, Richard. Glad to
And
be here.
I'm glad to have you here. How is home and how is family?
Thank you very much for asking. Home is well. Home is good. Everyone is okay.
Beautiful. Dr. Prosy, what inspired you into getting involved in the field of autism awareness and support?
That's an interesting question.
But actually, before you start, who is Dr. Prosy? I almost forgot that.
Okay. So I'm Dr. Prosy Nakanraji.
Yeah.
I'm a mother to
Yes.
3 wonderful children.
Yes.
And one of them, my first son, Matthew Musita, is on the autism spectrum. And clearly, that should show you that I have lived this life. Yes, and that is part of the inspiration why I'm in autism. But apart from being a mother, it would be 16 years ago, I founded what is now called the Advancing Autism Family Support Organization. Actually, not 16 years ago. It's 2016, so that makes it about how many years? And the reason behind Advancing Autism Family Support Organization was that while I was a medical doctor, I was also finding it very difficult, or my family was finding it difficult to cope with the diagnosis. And I wondered what the rest of the parents were faced with. So Advancing Autism Family Support Organization is a psychosocial support group for families that have loved ones with autism spectrum disorder. So we started off as a psychosocial support just to share experiences, challenges, and to support each other walk the journey. But over the years, we have gotten ourselves busy in autism awareness activities because we realized that by us knowing the condition and talking about it within our circles was not enough. So we are now involved in autism awareness activities, empowerment activities for those that have children with autism, as well as advocating for our children. And more recently, I co-founded Blossom Spectrum Wellness, which is an establishment to basically deal with the challenges that come with that diagnosis. So the challenges that come with a diagnosis are usually, one, no one goes to hospital to have a child with autism or a developmental disorder. So when you're told that your child has autism, usually it shakes the whole family. So we thought it wise that in our times, there was no place for us to go as families to seek counsel, to seek counseling, to help us walk the journey. So we are offering mentorship, coaching, services to parents and families so that they are better placed to handle the condition, to understand what it is, and the best way to raise these people to live fulfilled lives. But we are also, because we have the professional experience, but we also have the lived experience, which is very vast. So we are sourcing for anything that could help. That would span from supplements, assistive devices, just to make sure persons with autism are not left, without any support. So we are supporting families, we are supporting the community to better understand what autism is. And this is partly what I am here for, to educate the masses about autism, because we gathered that having autism mentioned in the month of April alone is not enough. So any opportunity that we get, we share word out there with others who may not necessarily be in the autism community or affected. But, with these educational talks, our hope is that many people will understand that this is not just a condition in the US or in the developed world, but it is here with us. And also to paint the picture that if persons with autism are supported, adequately, they can live fulfilled lives, they can live productive lives. In a nutshell, that I think can serve as, the introduction. Thank you.
Thank you so much, Madam Dr. Prosi, and we are going to come back on Blossom and the other foundation to see how well this page can be part of the campaign to support the autistic programs in Uganda, because that's one reason why we have this page. We believe that there is so much more that we can pass out to our masses. And one of the aims and objective of this channel, we always say, to empower people with knowledge so that they make better decisions on healthcare when it comes to healthcare, because we believe that whereas so many people are pushing political agendas, maybe other agendas, we believe that some diseases have been left behind. And yet there are people like you and me that maybe have interest in some or have gone through experiences in some. So your coming here is really very important. Let's start
Thank
here,
you.
Dr. Prosi. Many people hear the term autism, but may not actually fully understand it. How would you describe autism in simple terms to someone that is new to this topic?
Okay. So autism is a developmental condition that leads to brain differences all the way the brain functions. So developmental is that it happens during brain formation, and it leads to differences in the way those affected communicate, interact with the world, and also perceive the world. So that would be the description. But because it's already complicated, I would like to also mention how those affected usually present. And like he mentioned, autism is not a one size fits all. So the presentation is varied because it's a spectrum. You could find those that have many of those symptoms that I'm going to mention, or just a few. But usually, I mentioned that persons with autism struggle with communication. So when that struggle with communication ranges from those who are totally non-speaking. They don't like, those that are actually on the spectrum don't like to be called non-verbal. They prefer the word non-speaking. They may not be speaking, but that does not mean that they are not communicating. So about 30 to 40% of those affected are non-speaking. Then you have those that speak, but their speech is not age appropriate. So you find someone, let's say at 6 months, you expect that a baby is able to be babbling. But these individuals that are affected, you find, may not be able to have those baby, happy baby sounds by 6 months. Then you find we expect that at maybe 18 months, a child has a few words. But these individuals may not have any words by 18 months. Then we expect that at 2 years, which is 24 months, that a child can make rather 2 or 3 word sentences, come and or go, please go, those simple sentences. These individuals may not be able to actually have age appropriate conversations, even when they are past 2 years. So you find, for example, my son is 17, but he will speak. But when you take him deeper to ask him questions, you'll quickly notice that he's not able to flow with you. So that is with communication. Then still with communication, you find that some speak, but they talk back at you. For example, if you greeted them, how are you? They will just respond, which we call echolalia. There are those that have delayed echolalia, or the early stage echolalia, which is immediately, how are you, how are you? Then there are those who will be able to repeat sentences, or even, let's say this live broadcast, someone can be able to play it back at you, maybe at the end of the day. They tape and just echo back, just like what parrots do. Parrots talk back, but they don't necessarily understand language. So that is with communication. Then I would like to break it down with, let's say, their social communication. You may find people, I'm saying people because it's varied, even the age. We normally want to say children, but children grow up. And there are people who have autism that, at least in the oldest that I know, is about 44 in Uganda. So when we say children, yes, they are still children, but they are adults with autism. So that's why I'm saying people. So you might find, for example, that children, they prefer to play alone. They don't like to share their, play items. They don't like to take turns. They are socially withdrawn. And that goes on also for the adults. You may find people who just want to be in their space. I'm not saying that whoever wants to be in their space would mean that they have autism, but these people tend to prefer their own space. They have poor eye contact. You find people who will never look up, they don't look to you. They are not interested in your facial expression. They just, there are those who even hide their eyes if you attempted to look at them. Then I would like to go to the behavior domain. You find that not all of them will be affected in the same way, but you find that some have repetitive behavior, let's say head banging, some head bang, others rock a lot when they are seated or tap their feet, when that's not what we know that we are supposed to do. Then there are those that like to fidget with their fingers, kind of like that's called pin rolling. Or you find people who are always, looking at their fingers in a particular way, or looking at objects. For example, they get an object and they sort of scrutinize it close to their eye, or look in a particular way as if a squint, looking as if they have a squint, but they may not necessarily have squints. Then you find those that like rigidity and sameness. They prefer sameness and rigidity as part of behavior. That if on Monday I put on a yellow shirt, it has to be yellow shirt and not anything else. And yet presenting something different would, because you're distracting their ideal or their desire of sameness, you may see them acting out just because of a very small change. There are those I know that if you were driving or you use a particular route to school, if you change it, that's a tantrum there, because they desire sameness. In a way, it is wanting to know what is next. You understand? Then a great majority have sensory processing disorder. Not everyone with sensory processing disorder actually has autism, but majority of them on the spectrum have sensory processing disorder. And how does it present? For example, the very common one is the auditory hypersensitivity. You find, I don't know if you've seen people who like to block out, it's also a telltale sign usually. You see a child, they're, let's say, at a party, the music is not too loud, but they prefer to block it out. Actually, this for some means maybe it's too loud, it's paining, it's uncomfortable, or I just do not want it. Okay. Then there are those who have visual processing disorder, and they don't like certain lights, certain colors. You may find that the baby always cries when there's a particular color, let's say green, and there are people who have gone on to postulate, and there are those who are on the spectrum who have come out to tell us that sometimes the things that they are averse to maybe cause them not just discomfort but pain. So when they are doing what they do, the rest of us need to be accommodative to know that it may be not just a simple discomfort, but maybe pain, But even if it was discomfort, why are we causing a lot of discomfort? Then there are those that have sensory, like I was talking about the sensory processing disorder. And as the senses go by, the sense of touch, there are those that don't like hugs totally. They don't like touch. They are averse to touch, and sometimes it's particular material. That's why you see there are those who prefer to walk naked, because maybe that particular material is irritating them. Okay. Then there are those who love it too much, that they like to rub on people, they like hugs, they like to touch, all still with the touch sensation. You may find that there are those who like to experience tiles, different objects, holding on to objects, different objects. You may find one who likes to hold maybe threads, a piece of cloth, a particular toy, because it's giving him or her sensory input. What other sense have I not spoken about? So the whole sensory processing disorder is also something that is so broad, and we are greatly learning about it, because in the past you'd easily pass it as, oh, the child just doesn't want to maybe put on clothes, but maybe that material is irritating them.
Oh, okay. Thank you so much for that broad introduction, and I believe all our viewers are properly. I think we are now on the same page. Dr. Prosse, what are some of the myths and misconception about autism that you think you need to clear up first here?
Okay. The first one would be that autism is a disease and therefore has a quick fix. I will tell you that while I am a doctor, I also fell prey to some of those. You know, in your desperation, you want your child to be well. So people sometimes come up with things or remedies that tell you that they are going to be, off the spectrum like the next day. And that takes money. And imagine the emotional turmoil for the families who are expecting to run away from this issue called autism. But also especially, I don't know whether it's Africa, but one of the other common myths is that autism is because of poor parenting, structures. People have loved on their children too much. You've not given them direction. And I would like to say that it's far from it. If it was poor parenting, then it would affect all the children in a particular family. I have 3, and I've raised many in my family, and it's only my first born biological child, but I've raised other children. If it was poor parenting, then it should affect everybody, So it is not poor parenting. And still, there's this notion that maybe it's because of witchcraft. Because of witchcraft. I would like to tell the viewers and anybody who comes across this that autism is not due to witchcraft, just like any other condition. By the way, it's not the only condition where we do not know the exact cause. There are many others. Even in simple cases like in conditions like hypertension, sometimes we are not able to understand what caused the hypertension in that particular individual, but that does not mean that it was caused by what? By witchcraft. It is also not caused by, I talked about poor parenting. I talked about, there are those who will say, okay, yes, it's not witchcraft, but maybe you sacrificed the child to get wealth. One, in the past, people used to think, and actually you'll be surprised that there are those who still think that autism, or it's only families that are well off that have children with autism. That is far from it, because in the community we are seeing people who are going through extreme challenges of poverty, and they also have children or persons with autism. And yes, we see those that are wealthy and have this condition. So autism does not respect color. That's why you're seeing it among the whites and among the blacks. It is not limited to a particular social class. It is not limited to a particular religion or faith, Because the other myth is that these children are possessed. These children are possessed, and maybe we need to pray. I am a Christian. And I believe in a God that is full of wisdom, and he's all knowing, as we know that he's all knowing. However, just like we are fallen, we live in a fallen world. So because we are in a fallen world, things happen. So autism is one of those, So it is not that, yes, prayer is good. And because first it calms you, you know that you're not walking this journey alone, but to believe that it's spirits. Yes, if they are spirits and you believe they are spirits, you just like in hypertension, maybe there's spirits, but it is not that. Autism is because a child has spirits, or is bewitched, and therefore they need to cast out these demons. I think you understand what I mean. So, but I'm not saying that prayer doesn't have a role. Prayer has a great role because we are faith beings. If you believe in the power of God, in that higher power, God directs you, he enables you, accept this diagnosis, he helps you connect with people who are going to do life with you. But also, while I said that there are no quick fixes, there are remedies that can actually help with some of the challenges that we experience on the spectrum.
Okay. Again, I want to remind our dear viewers that the guest we are having today is not only a learned friend in the medical world about autism. We are talking to a parent that has walked the journey of autism for more than 15 years now. That's the difference. It is too different for me to come and talk about high blood pressure. It is another experience if I have high blood pressure and I'm discussing about it. So today we are having, I'll call a full package from a parent, a medical expert, but also an advocate. I always also give an example that it's different for me to advocate for HIV if I am not having it. It's totally different if I have it and I'm advocating for it. So we are grateful to have you here. Dr. Prost again, autism is often seen as through behavior that are visible. And so many times we wait for those visual things to say, oh, I'm going to wait for years, I'm going to wait for this. But what are some of the unseen challenges that individuals on the spectrum actually may face daily?
Wow, that's a full package. The challenges, and for me, I've been lucky that my son over the years developed speech and language, because then he's able to explain, in a way that he's able to. First is that, one, there's the assumption that people with autism do not understand. And that is I don't even know how to say it. Just imagine Mr. Chimbo there. You know so much, you understand everything around you, and yet people think you don't understand. How does it feel to you? You are in the audience, and you know the subject matter, and everybody's overlooking you. So that is their life. They may not be able to communicate things in the way they're experiencing them, but that does not mean they're not experiencing them. Like, for example, I'll give you my son recently told us that, people are so mean. You greet someone and he doesn't respond. So we don't know when that happened. Maybe he greeted someone and this person just passed by him. So imagine the pain, the rejection. You want to interact, you want to greet someone. It is socially acceptable and someone does not respond. And yet, they sort of live in a pure world where they don't think that someone shouldn't respond. So that is the one thing that I feel is very deep, and it makes me very emotional thinking about it, that people imagine they don't understand. Then many times, still related to understanding, we say that non-speaking or non-verbal does not mean non-communicating or non-understanding. So sometimes they're there, and as parents, as community, we talk over them and about them, you know, giving examples. Like if you're a parent, you're like, ono muntu tawulira, ono muntu takola kino. Or you're talking to the doctors. When we take them to the doctors, are we engaging them, or they're the silent participants? It concerns them, they understand it, but they're not able to voice it. So truthfully speaking, those things break my heart. I usually tell people that if my son was still nonverbal, I don't know what I'd be doing by now, because I was very interested in finding out what it is that he was thinking about. But also I mentioned about the sensory processing disorder. When they are holding their ears, it is heavy. When my son got language, we asked him why he was holding his ears, and he said, oh, eardrum is very painful. So imagine you're going through this and people don't understand that you're in pain, or their skins. Maybe a child is rejecting a particular cloth, excuse me, and the parents think this child just wants to walk around naked, you know. I wanted to first address what they go through. Then the other thing is that there are those who have ADHD as well, attention deficit hyperactivity disorder. I recently found out that their mind does not stop. And this was from a doctor. She's a doctor in the UK and she has ADHD. And she's like, you people, your mind stop. So imagine a mind that does not stop. That's why, so they are not sitting, they are not focusing, not because they don't want to focus, but their mind is, always coming up with other things to be done and completed. And the rest of us, how are we looking at it? This child does not sit. Even the therapist, this child had better learn how to, focus. So those are, I wanted to speak for them. But now I would like to tell you about, like, let's say families that have persons with autism. The judgment, those are silent, what do I call them? Sometimes a judgment is spoken. Other times it's the way someone looks at you. You walk with this child, let's say to church or at a party, and then someone is like, why don't you leave them home? Imagine the emotions that evokes in a parent, because this is your child. The same way you love your children, the same way the rest, want to experience their children, is the same way these families want to experience theirs. But on the contrary, because this one may have queer behavior, or may do things that may not be sorry, maybe socially appropriate, then someone is telling you what they tell you, and it breaks your heart. If you're asked 1 or 2 times why you're bringing this child to church, some people have decided not to go to church, and we're very grateful for churches that are coming up, like Watoto on Tinder has come up. I think St. Luke also. But I also want to mention a very small church in Mugongo, St. Stephen's, who have actually walked this journey with us, where we are not, where we are accepted to go to church. Okay. But believe you me, Richard, it's difficult to even fathom the pain the parents go through in terms of costs. When the children are younger, in a typical family that do not have a child with special needs, by 2 years, your child is at home maybe left with a nanny, or you mind your child. But by two, children with autism, for those families that have come to know, they're already in therapy. So they are spending through the nose. Okay, yes, therapists and everybody else usually is like, no, those families have money. But that's not true. People struggle to pay for therapy, So while the rest are saving for until their child attains age of school going age, that is usually maybe depending, maybe 4 years, someone has already started spending. And what are they paying for? For their child to play, to learn to play, because many times they are not able to play. They have to be taught, the play, play skills, turn taking, things that come naturally. Toilet training is usually a lesson on its own, not just, that's with any other child. It's harder for those that are on the spectrum. So there's when you talk about the pains, there are pains that are not visible to anybody else. There's financial struggle, and it cuts across the the social the social classes. Because yes, you could start off, you want to pay for this, you want to pay for the other, but with time you realize it is too expensive. And I'll speak for Uganda,
Yes.
where most families procure the services of therapists through privately. It's very costly. It's not like in the West. When these children get the diagnosis, then they have a system. There's no the system is not adequate. You know, I don't know if you know about the occupational therapy and speech therapy in Mulago.
Yeah.
I mean, a child would get maybe 1 hour,
Mm.
1 hour every 2 weeks, and we know it's not sufficient. So because we know it's not sufficient,
Mm.
then the parents need to add on through getting these services privately, which is very costly. But also, can you imagine,
Mm.
um, there are times when you make decisions,
Mm.
and because of this diagnosis, I think nothing should be stopping anybody, but this diagnosis can stop you. I
Mm.
know families that don't go out with their children, so that is already pain. Sometimes it's not because they want to leave them home.
Mm.
Sometimes it's because where they are going, there are no accommodations. You know, this.
Uh,
Uh,
uh, yes, Dr. Prosi, you're raising actually very pertinent points here. And I always tell people that my understanding with actually autism, I came so close to autism through my best friend somewhere who eventually had a child that was later put on the autism spectrum. But the judgment that this person got even from us, the medical people, the judgment that this person got from his family is alarming. So I actually want to again to tell friends that indeed, if you have a child that is on this spectrum, we respect you, we appreciate you, and want to remind our communities today that these are children. The first time I actually had a friend of mine come here talk about autism, Mr. Brian Kagombiro, who is a speech therapist. He helped me understand something. He said, look, it's just like us if you leave Earth and go to space and you find people there. Oh, I don't know if they are aliens like we used to believe. Or, okay, imagine you leave Uganda and go to any other country. You're going to find another group of people whose understanding of things is different.
yes.
So that's how the community should actually start looking at autistic children and everyone on the autism spectrum. It's not true that they don't understand, but they do their things in a certain way, just like you would move to any other country and you have to fit in. So
Yeah.
actually, I find it rude sometimes that we force them to understand us before even move an inch to go into their world to understand them. And I think that's why
Very
we are
true.
finding the biggest problem. How I wish
Mm.
all of us would start to see everyone on autistic and on that spectrum in that way, that you see they are living in a world where everything is perfect, where there is mutual respect, where they expect theater to be theater, where they say, if I don't like this, no one is going to force me to like it. How I wish we just understand their world, be factual. We want them to understand the world. And again, I'll finish this by saying that us being the majority doesn't mean they are wrong.
Very true.
Actually, it might call that we start to look at autistic children and everyone on that spectrum as someone that is in their own world, where, and so we should start actually putting steps to try to get into their own world and understand. It's not true that they don't communicate. No, they communicate, only that you don't understand their communication. When they block their ears, it's not that they are telling you something. The question should be as to understand what exactly do they mean when they do ABC. That takes me to the next question, Dr. Prosi. There is always an issue when it comes to sensory sensitivities like sound and light or touch. Um, and sometimes it is not obvious to other people. How is this issue of sensory sensitivities in on children that autism, how is it a challenge, and how can a parent that is having a child out there actually try to deal with it? We may now try to summarize because we want to wind up the program.
Okay. So sensory uh, processing disorder and those sensory sensitivities is a
Mm,
real challenge.
mm,
That one, we need to understand they are not faking it, they are living it, you know? And
mm,
I usually want to say that before you correct, please connect and understand. And as you rightly said, and I
mm,
want to emphasize that behavior
mm,
is communication. They may
mm,
not be able to say that this is painful, but
mm,
actually, if you look very closely and maybe you have read, you should understand that they are going
mm,
through each or the other. So with the sensory, the very first thing, if you can modify the
mm,
environment, it would be good, because then you don't want to cause a lot of pain, unnecessary pain.
mm,
If you can avoid very loud noises in their
mm,
presence, that would be ideal. But sometimes it's not ideal. It's not possible. You're in a public place.
mm,
So having noise, for example, I'm talking about the auditory or the hearing,
mm,
when you see them touch their ears. If
mm,
it is too frequent and causing a lot of distress, families sometimes advise to use noise cancelling headsets or headphones,
mm,
such that the some of the noise is
mm,
blacked out. You know,
mm,
um, but also working with the occupational therapists, they
mm,
train them. There's auditory sensory diets. They are
mm,
trained, and I had an opportunity to use some of those things. Sometimes it's like exposing them to
mm,
different volumes and types of music. Should I say music of different types, such
mm,
that their ears are. It's like it's training them to
mm,
perceive different um different noises. You know,
mm,
yeah. Then for the touch, if for
mm,
example a particular material had, you may notice that, let's say it's nylon, so you
mm,
try to avoid the nylon or
mm,
the tags on clothes. Some of them are
mm,
very they get very agitated with the tags. Clothes,
mm,
the tag can be removed so that you make it easier for them. Because
mm,
while we want them to always learn, imagine
mm,
if it were you and maybe you're feeling thorns in your skin. Would you again want to just cope, or you'd want to do away with it? So where you
mm,
can do away with something, the
mm,
better. But I know that there are those who don't like to put on clothes totally. So you
mm,
want to experiment with the different types of clothes.
mm,
The sensory, there are those what we call picky eaters. They will not eat
mm,
certain types of food. And sometimes it's also a sensory issue.
mm,
Maybe the food doesn't taste right in their mouth. We struggled with cassava in our
mm,
household. He would
mm,
just say, I don't eat white thing. He wouldn't even, it wasn't food. He would just say, I don't eat white thing. He doesn't.
mm,
Yams. I mean, there are things that was not food. Up to
mm.
date, we don't eat millet. Kalo. You know kalo?
Yeah.
Kalo. He just
Yes.
says, no, I can't eat the brown thing. The brown
Mm,
thing failed. So some foods will not
mm,
be possible. You want to, if you are family, you want to see if it
mm,
is all foods. If it is just one or two foods, you
mm,
can, you know, put it away for a time being and grade, introduce them to different types of foods. So
mm,
usually if you enrich the experience in a particular area, it
mm,
gets better over time. If they're totally against it, you may
mm,
want to do away with it. But sometimes graded exposures helps, because there are those who don't like particular colors. But if
mm,
they're exposed to different colors, one at, you first of all want to identify what is offending, what is that item that
mm,
they're really averse to, you know, and you grade the exposure. I mean,
mm,
I fear cats. You're not going to put me in a room with cats. It just doesn't work. So while we push them into experiences, we should be
yes.
mindful
Mm,
that sometimes it's more than what you think. I can't
mm,
be in a room with a cat, for example.
mm.
Yes.
Okay. Thank you so much for that. And then there is something that is actually called an autism spectrum. I want
Mhm.
to ask a question for a friend of mine here. Can you explain the difference between high functioning autism, because that's what we normally know, and the other areas on the spectrum? Because it's like each time we talk about autism, we rush to relate to the high functioning part of autism. However, we believe that this spectrum also has other areas on the spectrum.
Mhm.
And also in that hope roundup on why sometimes labeling could be misleading.
Yes. So, autism spectrum disorder, as it is in the name, it is a
Mm,
spectrum. So, a
mm,
spectrum usually is an array of things, you
mm,
know. So, even on the spectrum, you find those that are mild.
mm,
That means their presentation, you can even miss it. Yeah. There are those that are mild, moderate, in the middle there, and those that are severe. Um, Some like to say level 1, level 2,
mm,
and level 3. So
yes.
level 1 is mild,
Mm,
and level 2 is moderate, and level
mm,
3 is severe, or some
mm,
what people are calling profound lately.
mm,
Profound is the other term that is coming out very strongly lately.
mm,
So mild, you find that, and even when we say someone is mild, it doesn't
mm,
necessarily mean that everything
mm,
that I mentioned is mild. You may
mm,
find there are those that are maybe they're
mm,
socially awkward in
mm,
some aspect, but the rest is okay.
mm,
Their intellect is okay. Maybe they are able to speak, you know,
mm,
and they are able to live independently. Most of the mild autism, they are
mm,
able to live independently, and you may miss it. Maybe it was a student in your school back then that you
mm,
noticed maybe they were socially withdrawn,
mm,
but they will surprise you by being very intelligent. So the
mm,
intelligence covered up for all the other things, maybe they
mm,
liked to they were fixated on certain things,
mm,
they were fixated on certain things, but they could do life.
mm,
When we talk about level 2 or mild, if you come across them, you'll be able to
mm,
know that certainly there is a problem. Maybe their communication is not age appropriate. Maybe they have that behavior here and there of some of them like kicking stones, for example. You see this big person who is kicking stones, and you're thinking it's not culturally or socially um, appropriate. However, I would like to say, who said we are the normal ones? Who defines normal? And I liked when you said that even if we are the majority. Yes, but who said you're normal? Who said you're normal? Who tells that you're normal? So in the mild, rather in the moderate, someone gets to experience, they have symptoms here and there, but you're able to know that they're on the spectrum, but they are doing life, semi with assistance. They can be independent, but maybe this is a excuse me, this is a person who can maybe walk on their own, but maybe they want to be able to catch a train. You know, you notice that the mild case, someone is able to do many of the things with some difficulty, with some, but they're able to live independently. Then in the profound or severe, or what they call level 3, someone needs assistance to do activities of daily living. There are people who are not toilet trained even in their adolescence or older. They need that assistance. They don't need just verbal prompts, like for example, they need to be they need to be seated in a train. Maybe the parent has to hold them down. They have to be told to sit down. Yet these other ones, maybe they need a verbal prompt or they don't need any prompt. Okay. Then in the profound, you find most are nonverbal or non-speaking. They're not able to communicate their needs. They might have extremes of behavior, and some of them could even be violent outbursts, And by the way, even with violent outbursts, it's a way of communication. I don't understand what's going on. I don't know what you're telling me, or I know what you're telling me, but maybe I don't want it. So it is true, it is a spectrum, and not everyone experiences it the same way. It would be ideal to be on the milder side than on the profound. That's why lately people are talking about that autism is a trend. I've heard people talk about autism is a culture, so nothing should be changed. That is easily said by someone who has mild autism, because for parents or families experiencing severe or profound, they would pay anything, including their last cent, to have these symptoms of autism alleviated, because they can hold back the family, hold back the individual, because if they are profound, then you can't go anywhere. Some of them require 24/7 type of care. So how do you tell me that such a condition should just be left, nobody should change them? There, and I would like to say that I think we're about to close. I would like to say that autism, once you get the diagnosis, early diagnosis helps if it is possible. In the past, we were getting the diagnosis much later, but we now know that if you get the diagnosis early and you start early intervention, why early intervention is that it's in the developmental period. So these children can be able to learn the skills, that is in communication, in behavior, knowing and learning all these skills. Like I told you, many of the skills that come naturally have to be learned for them, you know. But special education will go a long way for those who are moderate, severe. I want to say that given the right support, they can be able to do something, because I believe that a person with autism can learn.
Okay. Madam Prosi, again, don't worry, we have some time. I have a comment here that is really so pertinent. This is a medical colleague from Lubaga Hospital saying, "Oh, I've not heard someone speak about autism so confident and eloquent the way Prosi is talking about it. So thank you so much, Prosi. And again, as this page, we promise to keep airing the voices of the communities we feel are unheard and voices of people we feel need more attention from all stakeholders, from government, international organization, and also in our communities. Madam Prosi, what are some of the challenges families of autistic individuals face that most people do not realize?
First, when many times you suspect, as a family, at family level, you may suspect that the child has autism, but knowing where to go is still a big challenge. Because, for example, in Uganda, we have very few neuropeds. We have one or two developmental pediatricians. So, yes, a healthcare provider, most of them will have an idea. But I will tell you that there are those who do not know, who are also still saying, omwana alina ekyejo naye nga musawo. So we still have a long way to also educate the health workers to be able to assess and make an appropriate diagnosis of autism. Yes, there are many other pediatricians who are helping us, but there are, I'm speaking for myself as a parent, but also representing other parents. Getting a diagnosis is still a challenge. Once you get the diagnosis, knowing what to do, because there are so many voices telling you, first of all, the witchcraft thing, the poor parenting. So that judgment tends to hold people down. So there's stigma and discrimination. You do not know where to go next. Because if you could ask a healthcare worker with a diagnosis, they will tell you that they go through that, knowing what to do, knowing where to go, you know. Then the challenges with finances. I mentioned that the therapies are available at, let's say, the national referral hospital, the regional referrals. But even at a national referral, if you're lucky, I used to get one speech therapy session, one OT session once a week. And we know it's not enough. It's not adequate, you know. So if you're going to get adequate therapy, you have to pay out of your pocket. And until recently, even insurance was not covering therapy. Thanks to some insurance houses, they are now covering therapy for autism, but previously were not. So it becomes very expensive. But also the fact that lack of understanding in society, at family level, society, you know, moving around with a child with autism can be very daunting to parents because you fear to be judged. Yes, you're human. You want your child to be accepted. Any slight judgment can make you coil. So those are some of the challenges that people actually go to. Then education is the other challenge. The
Um,
schools.
Actually, Prosi, as you go there, because I'm also passionate about education and inclusivity, because personally, I believe that maybe if I was given a chance to go back to school, there are things I would never, there are classes I would never attended. So that clearly communicates that, like I said, autistic children are children in their own perfect autistic world that we've not explored. Take it like a universe or a planet that we've not understood, that we are trying to understand. So I believe there are things that they would love to learn. So how can schools, number one, workplaces, because today we are lucky that most of them are still in our understanding is that this is a new disease, but maybe the actual thing is that we've lived with these people longer than we've actually able to explain. So how can schools, workplaces, and the community move from awareness to true inclusion?
First, I would like to correct that they are not all children. I mentioned that, yes, they are children, but of varying ages. The
Yes.
oldest I know is 44. So that
Wow.
means we've lived with persons with autism and we did not know, and they
Yes.
did not get the adequate support. And because they did not get the adequate support, maybe they will not be productive. So families have to continue taking care of them. But about inclusion, and this is, we've been talking about inclusion lately.
Yes.
People are calling themselves inclusive schools, but it is said as a trend, something to attract another parent um, to their school. So true inclusion would mean, or what it should be like, it should start from the policies. In this country, at least I'll speak for Uganda, we have very, very nice policies. We have, I think, universal primary education of 1997. We have universal secondary education, and those speak to the fact that everybody should have access to education, no matter their social class or disability. However, do we have implementation frameworks in place? Are the schools ready to take in these people with autism? There is a mindset. There, I lost count of the number of schools my son has been to. There are those who accepted us. They were, yeah, we will manage him, only to be told 1 week later that they were not able to actually educate him. But imagine this parent has paid admission fees, bought a uniform, and bought the first things, and maybe paid the first term, and they are told they are not able to actually handle them. So, as you tell a parent you're not able to handle them, who is supposed to handle them? And these schools usually don't give you an alternative, you know. So, true inclusion needs to start from the mindset change, knowing that there are persons with different abilities. There are persons who have, it's easier when someone has a physical disability. Everyone knows that they need a ramp. Everyone knows that they need a wheelchair or a walking frame or clutches. But persons with autism, when you're talking about inclusion, have you put in place a structure that is going to facilitate their learning? I will tell you that most of them are visual learners, such that if you start talking and talking, you lose them. But being visual learners doesn't mean that they cannot learn. So do we have the right platforms, to teach them? Do we have the tools to teach them? Those that have visual impairments have brailles. These people, they need more of visual material than verbal, and they'll be able to actually come along with their learning, you know. But we have teachers who still say, oyo mwana wa kyejo, oyo mwana tatula. We know that even when they are walking, I know that if you have a class and you have one that is walking around, they will disturb, the concentration of the rest. But I wish people knew that as they are walking along, they are actually picking what they are able to pick, you know. So we need to have the right mindset. We need to have the right environments for them. And the environment comes from the mindset. If it is a school, have you educated other learners about autism or about special needs?
Thank you so much again, our viewers that are still glued here. It is a very interactive, very important, and actually one of the most captivating discussions we've had on this page. I have a soft spot for people with autism, and each time I have a chance to invite someone to come and share with us, I always feel privileged and always feel honored, like to have them. Again, if you're here and you're having a question, leave it in the comment section. Our guest is still here with us. Like you said, Prosi is not only a doctor, a medical doctor. She's a parent that has dealt with a child on this autistic spectrum for more than 15 years. And to some people, if this was not a medical doctor, like where we come from, we always say this is witchcraft, this is a spiritual thing. But she's here explaining both medical and also experience as a parent. Let's try to understand people on autism spectrum, and let's try to support them. From today, we are going to be running a campaign on this page to support children on this spectrum in any way possible. They need gadgets, they need learning aids, they need educational materials. Please, if you're there and if you are there and you would love to join this cause, I want to champion this. We are going to solicit any funds to help their learning. In this Western world, I've seen learning headsets. Please, any $1 that you can put into this cause, trust me, is going to transform a life. We've got to adjust. Just like you go to China and you have to learn Chinese, you have to whatever. This is the same way we need to understand autistic or autism in us. Prosi, thank you so much for that, because I want to give my personal experience. I'm a soccer coach, and trust me, I've been in soccer for so many years, serving both in Uganda and here in the US where I am for school. And a few weeks back, a parent comes to the pitch. He say, "Oh, they told me you love soccer, you're coaching children," and he says, "I have my child. He's on the spectrum." And I'm like, okay, where do I start? But because I've been part of these spaces, I really try to get into the brain of this boy. So I understood that this boy can only be active for 5 minutes. He needs 5 minutes in, 5 minutes off. So when I understood this, I now started to make a program to accommodate him on a daily. And even when they are playing tournaments, now I tell the tournament organizers that I have a player who will be in and out for 5 minutes. If he wants to go in, he's going to go in. And so these actually were so supported and said, yes, each time they even gave him a special flag. Each time I raise that flag, they let him come in. And each time I raise, he tells me, "Coach, I'm tired." He's the only player that actually is allowed to go in and out wherever
Thank
they feel
you.
like. So I think that is how we need to understand. We leave our selfish world to get into their world and try to understand them. Proceed as we conclude. Many parents feel overwhelmed after their children receive diagnosis. What words of encouragement and advice would you give them? Number one, as a doctor, but also number two, as a parent that has successfully lived with a special child that is on this autistic spectrum.
Um, First of all, I would like to say that your feelings are actually valid. And I want to encourage people to feel the feelings, because when you run away from them, you only prolong the process, or sort of you're disenabling yourself. So feel what you have to feel, because I would like to tell you that it is actually a loss. You have a loss of the child that you expected. And after feeling those feelings and grieving, if you can, it is good to embrace the child that you have been given. That is the number one step. When you embrace this child, accept them for who they are. You now, it's like changing a journey. If you are going to, if you know you're going to Masaka, and when you're in somewhere, they tell you it is a different journey, you accept and move on that particular journey. It's important to seek for support. This support, sometimes you're able to get it within family, your immediate family. If you're able to get it within your family, your friends, that will go a long way. There's a proverb that says it takes a village to raise a child. Now, I think it takes villages to raise a child on the spectrum because of the different challenges. And from time to time, if a feeling comes in, experience it, you know, accept your feelings and feel them. However, I'd like to tell parents, don't stay there too long because you have work to do. You have this child who is waiting for you. And as a parent, you're their greatest and you will always be their greatest advocate. Let no one lie to you that it will be the doctor, it will be the society. You as a family, you as a parent, you're their greatest advocate. So if you need to be well to be able to advocate for them, seek for the diagnosis where possible. However, I've worked with parents who are like, Prosy, give me some time. I don't want to hear it. I don't want the label. I still accept that. However, I say that if you've identified challenges, let's work with the challenges. We have a challenge with communication. What can we do for this child? I would like to emphasize that as early as possible, please find a way of communicating with this child. Communication goes beyond speech and language, you know, it goes beyond speech and language. Find a way to communicate. There are therapies, get into, and I don't want to say that the therapies will cut across. If your child has challenges with speech and language and communication, they will need speech therapists. Okay? If they are not able to play appropriately, they're not able to do age appropriate activities, then they need occupational therapists. There are behavior therapists as well. If you find that the child has behavior issues and many others. But while we seek for all these therapies, it's important to connect with this child. I've it's very common to find that parents are running from one therapy to another without necessarily interacting with their own child. It's important to interact with your child, make them happy, let them find ways to connect with them. I've recently coined the word exposure therapy. Expose your children. It goes a long way if you expose them early. So imagine if you keep them locked in your gates all the time. The one time that gate will be open, they will disappear. Elopement is very common, or running away from familiar environments is a very common challenge we experience. And the news always has people, even in the United States, UK, where children disappeared. And unfortunately, sometimes they've passed on or the police found them. So when you expose them early, you know, they will disturb. Initially, it's difficult, but it gets better with time. You know, it is better to expose a young child than if they grow up in confinement. When they're in confinement all the time, the one day they will escape and actually escape. You don't want that. But because they have challenges, that doesn't mean that you stop living. Take them to the zoos, take them to the beach. They belong to this world. They are equal citizens. So find ways of connecting with them, making them happy. If you're not able to do all the therapies, connect with them. These days, there's a lot of information. YouTube, on Google, find out what these therapies are about, you know, and apply some of those things in the way you
Prosy,
interact with your child.
Prosy, talking about therapies, when we discuss therapies, most of the time our mind run to medicines. Now, beyond medicines, which I don't want to approach because they are people that are that are specifically trained for that. What are some of the effective strategies or therapies that you've come across as a parent?
Okay. So earlier, my son had challenges with speech. So we procured services of a speech and language therapist. And speech and language, they help you with a communication, not necessarily speech. Run away from speech therapists who beat their children all the time to force them to speak. You know, speech is also part of development. If my speech apparatus, and that will speak for muscles, the tongue, the way you roll the tongue, and everything else, the brain. Are you aware that it's the brain? We have a what? A speech center. I think it is area 46, if I remember right. 46, 47, about there. So it is, the brain is connected to the muscles, to the tongue muscles to give us speech. So it is not beating the child to speak. Okay. So communication, if you want to foster communication, you're talking about a speech therapist. If you want them to learn activities of daily living that are appropriate to their age, play skills, you want to procure services of occupational therapy, you know. But I would like to encourage parents out there, do not be shy. If you're not able to get into therapy, I hope you're able to at least get a few therapy sessions. However, if you're not, go to YouTube and learn. By the way, as part of Blossom Spectrum Wellness, we train people who are paraprofessionals. We can train your nanny at home to actually be able to work with this child, because sometimes paying for this therapy can be very expensive. It is ideal, but you know what happens. There are many ideal things that we are not doing. But I'd also want to say that other than therapy, the diets, you know, the nutrition is is important. You know, there are foods. You know, food is good for all health conditions, most health conditions. And the fact that I said I talked about the main offended organ in the brain would rather in the body would be the brain, but also the gut. So foods that support brain health, you know. In our country, we have silverfish, for example, mukeni. We have mputa. Those are good sources of omega-3. We all know that omega-3 is good in brain development. Okay. We know that protein from eggs, for example, lean meat is good for brain development. Beans. We don't want to say that, oh, we are only talking about expensive things. Even beans are good. You know, proteins are good for brain development. And there's also a role for supplementation, because while we are well meaning to have a good diet, we know that persons with us on the spectrum struggle with, some of them don't eat particular foods. So there are those that you'd have to kill first before giving them mokene. So what are you going to do? You're going to kill the child to give them mokene or mputa. Yeah. So you might want to supplement. There are omega-3 supplements, and more. Those we can talk. I think we can give a different talk. But there are supplements that have been shown to help with the different challenges we encounter on the spectrum.
Thank you so much. We go into our second last questions. Why do you think, even with so much advocacy, information out there, why do you think a society is still struggling to fully accept autism, and how can we fight stigma as a group?
Yeah. So first, I believe, at least I'll speak as an African, I think whatever an African does not understand, then it becomes witchcraft. We got into spirituality. You note that as a doctor, whenever you tell a patient, I remember, you remember the earlier stages of HIV, because people didn't understand, they said it was witchcraft.
Yep.
Not so.
Mm-hmm.
So autism has been around for some time, but it has been undercover. It was only known by those that had it. But unfortunately, even those that had it, even well-meaning doctors, I've come across doctors who say, ng'omwana wange yalina autism,
Exactly.
ng'omwana wange yalina kino. You know, so if a doctor can have such a perception
and mindset
and mindset, what do you expect? So because and I would like to say that the advocacy has come on, it's not many years when everybody's talking about autism. In the past, it was in our little silos of parents groups, of families, but it is now that increasingly it's coming to the surface. Number one is that whatever people don't understand then becomes witchcraft. We bring in spirituality, we bring in African culture, we bring in the spirits and all, and the bad parenting. But I would like to say that autism is a condition just like any other. Yes, the cause is not known. Exact cause may not be known for most of the cases, but we know that about maybe 40%, I think it is 40% to 60%, they say that the cause could be genetic. But there are cases where we do not know. But that does not mean that it is what? It is witchcraft. We know that there are risk factors. Risk factors are those things in the environment, in your body, in your genes that increase the chances or the likelihood of someone having the condition. So I would briefly want to touch on that. I've already said that we think it's multiple causation, like many factors, because it's a complex condition. Therefore, the causation is also what? Likely to be complex. Scientists are combing the literature, and you're aware that Trump has gotten very interested. They had given, I've forgotten the name of the gentleman's 6 months to come up with a cause, which I think was very, it was too optimistic. But we hope something. Uh, yeah. So we know that having a firstborn male, there's an increased risk. Firstborn male child, okay? A sibling with autism. If you have one child with autism, there are chances that you may have others. It is not true that it's 100%, but there are chances, okay? There's literature that suggests that children born to older parents, that is fathers and mothers, may be at increased risk of having children with autism. In my case, my first is the one who has autism, and I had him when I was young. Knowing I'm a doctor, I didn't have the children too young, but the one that I had later, how come for them they don't have autism? So that's speaks to the fact that it's complex. It's more complex than we think. They're talking about prematurity. Those that are premature are more at risk. Those that have had birth complications, challenges when the mother is pregnant, nutritional deficiencies. Folate and others are culprits for many conditions, but you may find a mother who has triplets and only one of them has autism. Remember, they are in the same environment, so how come not all three have the condition? So that speaks to the complexity of the causation. There are also there was a study that came out that said it was that paracetamol exposure during pregnancy. While it is science, personally, I scoffed at that, because which pregnant woman does not take paracetamol, one or two, during their pregnancy? So there are all these postulations. We do not have a one size that fits all, but at least we know that there could be a genetic predisposition. That's why you see that persons who have one person, like for example, you have a cousin that has a child with autism, you may find in that same family another child with autism. But also what is coming up that persons who are born to families that have other mental challenges, bipolar affective disorder, schizophrenia, they could have children who have autism, and many others. They talk about pollutants, but all my children were born around Kampala. How come one is affected and not the other? Then if it was pollutants, don't you think everyone in Chisenyi, in those crowded places, should have autism? You may find that they don't have as much autism. So, truth be told, I can tell you that the exact cause, is not known, and we only work with risk factors. And I would like to say that it is not the only condition where the exact cause is not known. But when people have diabetes, when they have hypertension, they are proud to talk about it. They do not say that they were bewitched to have hypertension. So because you don't understand doesn't make something witchcraft or poor parenting. It is another condition.
Again, so many positives here. Olivia from California saying so much. Thank you so much. This is well elaborated. Yes, Olivia from California and the Ugandan community in California. I want to approve you. Let's stand up for autism through Dr. Prosi and the Blossom organization. If everyone in California just give me $1 or $2, I'm telling you, we are going to create awareness that you cannot even believe. So to all viewers that are watching in right now, my call is we need to stand up for the autistic world, especially in Uganda, because number one, we are still even fighting with the basics, just like hoping the community just understand it. We need a process to be moving every radio station every weekday to make sure we understand it. When we understand it, then we shall call in more funders, more supporters, other stakeholders to come in and help with us. Because right now, I think the biggest need is awareness. We totally need to accept it, just like we've accepted so many other health conditions. Then from there, we can move on how to help communities and other people in workplaces, schools, better implement places that can fit our children. Because these are our children. We, just like I say, the causes are complex. Who knows that your next child is going to be the one that is going to benefit from the talks and the effort that Process is making today. Process, you have children at home. You have relatives. How can friends, classmates, family, and colleagues support someone with autism in daily interactions?
Thank you very much. We are a family that is living that journey. Peer support is very, very critical. There are times where a parent is not even able to support this child, but their peer will. If the peers understand that they are not faking the way they are, their presentation, they are feeling what they are feeling. So it starts from understanding, that it is a condition. They have a condition that requires more support than the rest of us may need, and the mindset change. If, as parents, for example, we cannot be everywhere with our children, and I would like to thank my children. I always want to thank them, because if I don't, then they will see, maybe they will watch this discussion and they'll be like, but mommy, we give Matthew always support and you didn't mention us. So I'm thanking them for walking this journey with their brother, with their nephew, and with their, with him. Sometimes they need a peer, someone who is their age. Like now, Matthew doesn't want me walking around with him because he's a big boy. He's a teenager, He wants the coolness of being a young man. So it is important that we train these younger people in schools and in community to appreciate that there are people who are able differently. And actually, research shows that if children are exposed to special needs children, they grow up to be more compassionate and kind adults. Yeah. So expose other children to persons with disabilities and explain to them that they need support. By them giving support, explain to them about equity. The rest of them, yes, may not require all that support, but this person needs all this support in the, even just showing them that, like yesterday we were at a function and when we are out, I let the rest move with him more than I move with him so that it's age appropriate. And it doesn't take away that independence and coolness of being a young man. Okay. So he will work with a younger person to, they're queuing up for food and they're, asking for what they want and all that, just showing them, we are glad that for us, we've come to that point of he can interact. But for those that are not yet there, if you're able to get a peer, someone who is their age, in their age bracket, preferably their gender. The boys like to do life with boys as well because they are boys. Let them experience life. If the rest are engaged in soccer, I'm glad you mentioned about this person you're supporting through soccer. And that is going to help him a lot to come out of the shell. We want to bring them to our world. Are we bothering to go into their world? There are times when there's what they call joining in. They do those little things and take off a minute and join them. It doesn't hurt if you pin roll and show him. That shows that you are connected with him. Next time you show him that maybe pin roll at night or pin roll in your pockets. It will be someone is more likely to listen to you when they are connected to you than if you just give instructions. Yes.
Okay, Prosi, lastly, let's focus on the future now. And I promise you the next time I host you, I want you take us through the science of neurodiversity, because I think we totally need to understand this subject matter. And I'm so happy that I think I've listened. By the way, I love autism, and for some reason but I'm telling you, this is one of the best class I've had about autism, and I think you were indeed a right choice for our channel. In this section, we normally ask for short answers, 1 or 2 answers. Proceed. What would you wish? What would you wish people would stop doing when they interact with people on autism spectrum? What annoying things do you think, if you could just highlight them, that people would stop doing?
Number one, the assumption that they do not understand kills me. The judgment that the parents have not done their best, or they've not prayed, or they've not tithed, chokes us.
Talk about tithing.
Yes. The eyes we are given, they are getting fewer for us, but I told you I represent a community. Parents talk about the eyes, someone just gives your child this eye and you want to hide under the table, asking us, which class is your child? You already know I'm struggling. Can you let me explain to you? Some questions are better off not asked, What is your child up to? You know that the family is already struggling. I remember I struggled with that. There are those who would even call you. So what is Matthew up to?
Wow.
That's very unkind.
Yes.
Then consider leaving him home when you're coming for the party. Please, what is your home? Is it a heaven? God is so wise, and yet he thought that this child could be part of us, could be
mm,
here. So who
mm,
are you? The next
mm,
time it's coming across, you're coming across such thoughts, think
mm,
twice.
mm,
Um, for the teachers, telling
mm,
parents that you will not manage and you don't give them options, where do you
mm,
expect them to take their children? To the
mm,
government, when they are making these policies, are they thinking about persons on the spectrum? Are they
mm,
putting their implementation frameworks?
mm.
Because um, not every disability is visible, for example,
Yes.
you know?
Mm,
Yes, if you find out that I can't write, because some of them are dyslexic, some of them
mm,
have, can we have other ways in which people can write? Can they
mm.
type? But in this country, do we have computers in every school? Are teachers trained? Every school, do schools have special needs teachers?
No.
For the therapists, do you really have a heart? It hurts us when someone is a therapist or they
Mm,
come out as the people who we are supposed to run to, and they have the poorest attitude. My son at some point was beaten by someone who should have known better. You know, as you pause to have inclusion, are you really inclusive? Have you put in place the structures, the environment?
wow.
And this environment cuts across.
Mm,
Are the other peers trained
mm,
to accept this person? Because if they're in an environment where they are shown animosity, they feel it. So
mm,
imagine they are feeling the judgment and they are not able to talk back. And when
mm,
they beat you up, then you say they are being violent, but they are also communicating,
mm,
you know? So the next time you tell a parent, don't come with your child, think about it. This is
mm,
also my child. This is their child. They love them the way you love yours.
mm,
Then the other thing, parents, for all the general public, autism is not contagious. So have
mm.
your children interact with these people who are able
On the
differently,
spectrum. Mm,
especially if you want them to be compassionate and kind individuals.
mm,
Because you've had cases, there was a case with Planet Fun, a
mm,
water park, where a child was pulled out of water and they hadn't, their crime, I think, was having a disability. They're not putting that disability in water, and they're
mm,
not going to give this disability to other children.
mm.
I think I labored to explain the causation.
Yep.
It is not going to get you by swimming with them, by doing a move, by having a movie with them, by
Mm,
eating with them. So embrace them.
mm. Wow. Thank you so much, Procy. You've been in this journey for more than 10 years. What positive changes have you seen in autism awareness in the last decade?
Um, I feel like it's slowly getting out of our homes. Previously,
Mm,
it was in our home, just the home that had a person with autism. Then we
mm,
went in our little community. But we are
mm.
seeing many players getting interested in the subject. Although
Yeah.
sometimes we wonder whether they are interested for the right reasons. We have
Yep.
people, well, the parents we were when the parents were wallowing in self-pity and the
Mm,
challenges of raising children, other people who may some of them may not have had the heart, but they saw it as an opportunity and
mm,
they're exploiting that. However, I would like to say that we are seeing many more people getting
mm,
interested in the subject matter, but how I hope that we'll move from the interest to
mm,
showing real, like real understanding, real care, and wanting to support. Actually, through you, Mr. Chimbowa,
mm.
we wanted to pilot a learning platform that is
Yep.
visual, and we
Okay.
believe that it would help learners with autism. I
Okay.
say it from theory, but also lived experience. My son, if you animate anything, he's able to run with it. He can talk about fraud. And yet, if you tell him, he may not be able to, get what you're telling him. So there are things we want to do, like practical things. And some of them are not out of this world. To be able to give them an opportunity to learn. Because if you talk, like the way we are talking, he could parrot it back to you, but the understanding may not be at par. So we need to give them platforms. And personally, I feel that these are possible. There are countries that are slightly ahead of us, like Kenya
Yes.
is slightly ahead of us. And actually, my son got benefited a lot from being in Nairobi for 4 years. We went to a school that just embraced autism, and they did not do much. According to them, they kept on saying, no, we are not doing much. But I'm telling you, the son I took to Nairobi and the one I came back with were totally different. Why? He was loved, he was accepted, he was he was allowed to focus on strength. I don't know if I talked about strength-based interventions. If you find that a child is not good academically, as parents, as therapists, as the general community and teachers, could you focus on their strength? Actually, literature coming up now, they are saying at by 10 years, you should be able to identify their strength. It's not uncommon to find a center, a therapist, a teacher teaching this child something they've been taught for maybe the last 10 years. You know, button your shoes. If I'm not able to button for the last 20 years, can we move on to something else? And there are shoes that don't need to be buttoned, and maybe you can just buckle them. If I can't use a belt, what can you do? Because as you teach them these things that they are unable to do, please note that majority of them are aware that they are not able to do that thing. So I don't know which subjects you are good at, Mr. Chimbua, but imagine if you didn't like geography, for example. I'll speak for myself. And
CRE.
every class, CRE. Why CRE? So imagine if everything that they taught you was about CRE, your life would be very uncomfortable. So I want to speak for them that certain things they are not able to learn and they are aware. Could we stop harassing them by insisting that they have to learn that one thing? All of us don't have weaknesses here and there. Okay? So if you keep exposing me to my weakness, what does it make me? How how does that make me feel? You don't know a particular subject, and that's all your teacher ever gives you. And that's what we are doing. Rather than saying, okay, they are not able to do this, but they know computer. Let's focus on computer. You know, he's not able to do X, Y, and Z, but he likes art. Can we gravitate more to what they can do and do well rather than insisting, on if you did biology, for example, and it was easy for you, it doesn't make it easy for the rest of the world. So let's focus on that which they can do.
Wow. Thank you so much. And again, I promise I'll be part of that study on the visual on how we can support autism in any way. And again, I would also love to have a discussion on support of children on autism, where I'll invite you together with other people, speech therapists, the dentists, the occupational therapists, the physiotherapists. Because I mean, just like I'm starting to involve actual nutritionists. We need to sit together and see. And I think this is where everything starts. This is where we need to start thinking about this as a community. And again, you mentioned people coming on board for wrong interest. Yes, it is true. Evidence has been shown with people dealing in HIV. One time I was dealing with a fund, not a fund, a friend of mine who does monitoring and evaluation, and told him, Richard, if money that has been poured into HIV activity would be divided among people who have HIV, each of them would get more than 20 millions without,
Wow.
but we are putting so much money in administration of things, in administration, in management buildings, but the real patients of HIV do not have the next
Mm.
meal. So just like you're
Yeah.
saying, we need good-hearted people. And that's why me, for projects I run, I say, give me your money not to build structures. Give me your money to build hearing aids. I want 1 million of
Mm.
them, then I'm sure that those are going to be 1 million children benefiting. And that those again, I promise to walk this journey with Autism Society Uganda through, I run different sports organizations in Uganda. We are going to make part of this because, friends, the earlier we get used to this, the better we are going to help it as a community.
Yeah.
Like I said, to everyone that is pregnant, that child you're carrying inside could be autistic. These parents
Who
didn't
knows?
commit anything. And don't
No.
say you bind it in the name of Jesus. No. That's where we get it wrong. When we start spiritually binding things that are not spiritual. And to the positives, I also want to say, if I could give you a list of people on spectrum in this developed world and what they have been able to do, you won't believe. Most of the richest people here in the US are on that spectrum.
Mm.
And because of that, some of them, the prominent one is recently taking people to Mars and to planets. Because when it starts with, they discover that his interest is in space. He has forgotten everything on Earth. He doesn't care. Researcher have it that even doesn't have a house. He has so many baby mamas, but he's the richest person. And all his interest is in space.
Mm.
So that child on the spectrum may not be interested in the biology.
Yes.
But if you told him to operate musical instruments, he can even close his eyes and do things. There is one I know that is so interested in gadgets. At age of 16, he's been employed with one of the biggest phone tech companies here. Because when he gets your phone, he will tell you even functions that you don't know. And the parents say they have never taught him. He started by loving a certain type of phone that even now people were scared leaving him with phones because number one, he can dismantle it and put it back, but also functions that you didn't know your phone can do. You would record people, you would block people's phones in the house, and you would be just there laughing with the phone. So
Mm.
these children and adults have something unique about them and something that they can do better than most of us. Only that we've
Mm.
limited them to things we feel. That
Yeah.
entitlement, my children must be this, my children should
Mhm.
be this. That entitlement that sometimes we have as parents, we are closing
Mm.
them in a box where they don't fit. And trust me, the day we choose to support them, one of the greatest footballers in the world, he comes from a certain country, I won't mention the name, South America. Very familiar. He normally puts on jazz number 10. He's on a spectrum. Many of you don't
Mm.
know. He is on a spectrum. He's the best. They say school, he failed at everything. But when his parents gave him a ball, he will do everything with that ball. They went to the best academy, took him to a certain club in Spain. He made his way there, and today is one of the world best. Lastly, as you close, Prosi, how do you see the future of autism support and inclusion in countries like Uganda? In about a minute or two.
Um, I think we are getting there. Not yet there, but we are getting there. Because I recently attended a conference and I was mesmerized that Kaboja International put up all these players in place. So how I wish that many other people get on board, but this time thinking true inclusion, not just a trend, wanting to follow a trend.
Mm,
And with the right mindset, with the right
mm,
policies, with the right implementation frameworks,
mm,
with the right environments, the learning tools, I think it is possible. But I would like to give a disclaimer that not
yes,
everybody will actually be able to go to an inclusive school, for example.
yes.
there will be a percentage. I mentioned about those that are profound or severely affected. They may not be able to fit in everything, but if we change our attitude, our mindset to accept that there are people that are abled differently, then there is hope for us to see that every person deserves to be here, deserves to be on planet Earth. For example, people have accepted dogs. I have dogs and I love dogs. And I see, and when I see a dog, I feel like they also belong. They are different, but it will surprise you that I'm able to communicate with my dog. I will know that maybe she's unhappy or she's this. So if we embraced, if first of all we understood that these conditions exist, there are people who are abled differently, and it's not their choice, and it's not their fault. And the parents also are not at fault. Because many times people think, oh, maybe parents did this or the other. There's nothing that we did or didn't do. For heaven's sake, maybe we did more. And that shouldn't be a problem. Okay. So we need to embrace people as they come, to know that there are people who are able differently. And then we ask ourselves, how do we support them so that they're able to live a fulfilled and productive lives? I think the goal is to living fulfilled lives, whatever your ability.
Wow. Thank you so much, Prosi. Please send your closing remarks and greetings to your family and Matthew. Yes.
Okay. First of all, I'd like to thank you, Mr. Chimboa, for creating this platform,
Yes.
but more so for thinking about us. People have created platforms, but they think maybe we don't deserve to be there because, but here you are. You've demonstrated that you are for us.
Yes.
And we believe that if we all come together, there's so much we can do. And you rightly said that that pregnant woman does not know. We're not scaring them. But I mean, when I was pregnant, I didn't know that my son would actually be on the spectrum. But actually, you don't have to have this child directly in your family. You are a human being. Many other efforts that have been done that you didn't build all the roads. For example, in the US, you did not build the infrastructure there that you're enjoying. So if we could all come together to help other people in their times of need, you never know how that would play out for you at one point or the other. Then I want to say that person with autism can be very, very compassionate people, very caring. If I'm sick, I want someone, Matthew, around me because he's very caring and reassuring. If you're in trouble, he will easily know that there is a problem and he wants to support. So it is not all there that, oh, we feel this or the other. We love our children. I love my son and he knows that he's loved. I'd like to send my regards, like you said, to my friends that have walked this journey. They are those that have gone all the way. They have read. They have read. And some of my friends are readers. So they've read about all these interventions that I initially implemented. It was because of those people. And lastly, to my family. And that goes for my family on both my side and my husband's side that have been very, very supportive as we raised Matthew, and to the siblings and my children, as I like to call them, because children in Africa, it's more than biological. My children, my nieces, my nephew have been very, very supportive. They've walked this journey, and it's because of that collective effort that Matthew is where he is. We are very grateful to God, very, very grateful to God, because when we started off on the profound side, who knew that we would be where we are today? Today, I think if you assessed him, he would be level 2.
Mm.
In some aspects, we've really advanced a lot. There are those where we struggle, but on the whole, we are very grateful to God. And that's where I pick the strength to support other families. I support families through Advancing Autism Family Support Organization and encourage parents to join support groups. You can't do it alone. There are those, I think, because of socioeconomic status, they feel like, oh, this is our thing, this is our little secret. My
Mm.
friend, you'll burn, you will get all the, your mental health is important. So joining such forums helps
Mm.
you know that you're not alone. Human beings are social beings. You like to
Mm.
know, silinzeka. If you remember when people were being beaten in primary school, if you're
Yes.
many, then the strokes, you didn't feel that.
Eh.
Okay, personally, I feared sticks.
Mm.
Immediately the whole class, nze nali
Mm.
saagala kubibwa.
Mm.
But for most people, if you're many, you feel the burden lessens. But also,
Mm.
there are important discussions that we
Mm.
hold on those platforms. There are other support groups
Mm.
that people can join so
Mm.
that then they share information, they share challenges, their activities. Take advantage of empowerment talks that are organized, talks with, like for AFSO, the Advancing Autism
Mm.
Family Support Organization, we
Mm.
organize talks. Take advantage of those. You know, it is very, you feel supported. The challenge
Mm.
that you have today, maybe somebody walked that journey. And I mentioned that now I also operate Blossom Spectrum Wellness.
Mm.
And Blossom is basically what I wished I had when my
Mm.
son was younger. Someone, that listening ear, someone to walk the journey with me. If you
Mm.
need counseling, if you need mentorship, if you need coaching, come,
Mm.
we will be able to do that. But also, like I mentioned, therapies. We
Mm.
we may not, we have therapists that we are associated with, but
Mm.
we also can refer you to the best that is available. In addition, if you contact us, we
Mm.
can work this journey in sourcing for supplements, in sourcing for assistive devices,
Mm.
technologies that could help your child. Don't die alone in your house. We can walk this journey. Don't leave your child at home. We can advise you on the best way to actually handle this condition. We can advise you in as far as, yes, you can expose them. We are talking about exposure therapy. It is
Mm.
very, very important. There are parents who need to be, what do I call it? Who need to be supported to walk that journey. But we are saying for the workplaces, corporate organizations, we are talking
Mm.
about inclusion. We are talking about inclusion, inclusive hospitality. Your hotel, your restaurant, you may need a talk or two to help you learn how, number one, to understand that this condition is there and how to
Mm.
best support those, your customers, when they're in your presence so that you don't get bad media coverage when
Mm.
maybe someone acts out and your manager is not informed.
Mm.
And yeah.
Okay. Again, thank you so much. And that brings us to the end of our powerful discussion on understanding autism beyond the surface. A huge and heartfelt thank you, Dr. Prose Nakanoaji, for sharing your insights, your lived experiences, and expertise with such honest and depth. Your voice adds so much value to the conversation that is often missing actually from the mainstream media, even from Minister of Health. To everyone that joined us today, thank you so much for showing up, listening, and for being open to learning. Conversation like this, how show us how now we can actually move from awareness to true understanding and empathy. We hope you're walking away with not only knowledge about autism today, but a deeper sense of how we can each contribute to this society and then to create a more compassionate world. If you found today's session very meaningful, please don't forget to like, share, and comment, but also transfer this to the people in your world that actually you really love. Let's keep the dialogue going in your homes, in your school and communities. Understanding autism is not just a topic, but it's a commitment and a lifestyle that we can all choose to live. Take care of yourself, take care of each other. We'll see you next time here on Mr. Self-Care. Until then, stay tuned, stay curious, and I wish you a lovely Sunday. May God bless you, whatever you're going to do. From me and my producers here, have yourself a blessed Sunday. Bye.
Bye.
Mm-hmm.